Hello, everybody, and welcome to another episode of ICS Podcast 2024. I am Shannon Wallace, and I am on the ICS Education Committee, and I am so happy that you're joining us here today. So I have a very special podcast today. We're going to be talking about Workshop 8, which is setting up a robotic urinary tract and pelvic floor reconstructive surgery service. So this workshop will be offered at ICS 2024 in Spain, in Madrid, on October 23rd, which is the Wednesday, the first day of the conference, from 2 to 3:30. So I'm very lucky in that I have the chair of the workshop as well as some of the speakers joining us today to tell us a little bit more about it, as well as who might be interested in attending. And I suggest that once you listen to this workshop, you run out and register and sign up, because I have a feeling that tickets are going to go really fast. So thank you so much. I have Dr. Michel Wyndaele here today, who's going to introduce himself and tell us a little bit about this workshop and why he thought it might be a good idea to present it at ICS.
Hello, Shannon. Thank you so much for the introduction. Yes, I'm Michel Wyndaele. I'm a consultant urologist in Utrecht in the Netherlands, and I've been that since 7 years. We focus on benign reconstructive urology and mainly tertiary cases or patients, and we also have a whole population of congenital diseases which we treat in adulthood or later on. So from that background, in the past years, many years for now, there have been great evolutions in benign reconstructive surgery, both urological and pelvic floor. And how I came about to this workshop idea was because I myself went through this process of how do I develop from a open reconstructive surgeon to also offering the robot. And that was quite challenging to me. So it took a little bit of work, a lot of thinking. And my goal was to help others in the same process.
Well, I think it's a really kind of a novel idea for a workshop, because there are lots of workshops on like different surgical techniques and how you do these different surgeries, but there hasn't been a workshop that's really on how to set up like the nitty-gritty details of being able to do those surgeries and being able to actually have all of the tools that you need in place to use the robot. So this is a really fascinating workshop, and why sort of our education committee thought it was really relevant and really necessary in 2024 to kind of offer this to our membership. So we're very lucky today in that you have some of the speakers here as well who are going to be joining you for this workshop. So would you mind introducing them, and they can give us a little background and how they thought that they might be, helpful for putting on this workshop for us.
Absolutely. I'm very honored to have a faculty with enormous expertise, and also from all across the globe, because setting up a robotic service can be different in different parts of the world. So we wanted to show all these perspectives. So at first, I would like to introduce Eva Fong from New Zealand. So Eva, please introduce yourself.
So my name's Eva Fong. I'm a urologist from Auckland, New Zealand. And yeah, I'm also, like Michel, I went through I actually learned robotics in my fellowship in the US. But then we had a bit of a hiatus and I had to relearn in New Zealand. So like him, we went through the process of relearning the robot and then initiating a new public program. And we also did a new technique, which is robotic mesh removal. So we went through a very difficult journey, relearning the robot and starting innovative new procedures. So I also feel pretty passionately about, teaching others and helping them on the journey. And also about mentorship and proctorship and how we can support each other. And we were lucky enough to have Benoit come out last year and mentor us. So I think it's something we can share with others, how you can do it and how you can get the support that you need.
Oh, that's fantastic. And on that vein, we also have Benoit here today. So why don't you introduce yourself and kind of tell us a little bit about your experience?
So yeah, same thing. I really must say that I'm truly honored to be part of this fantastic panel. And for sure, if I was not a member of this panel, I would sign up for the workshop, because the other speakers are really fantastic. And when you look at the program, it's really appealing. We've seen, if we had discussed that 10 years ago, I think robotics was almost inexistent in our field, to be honest, because robotic per se has existed for over 20 years, but I think it was pretty much the same in every part of the world. First, oncologists took the robot for them. And so we had a very difficult time to get access to the robot. And I think it has probably started about 10 years ago in some places, but then it has spread in many, many places around the world. And I think now pretty much everybody at the ICS would have either started robotics or willing to start robotics or considering robotics, and it will continue to grow. But as Michel and Eva has stressed, developing from the scratch a robotic program is not easy. I mean, there are several challenges ahead, and as Michel, I think, has really nicely emphasized, this can be different from different parts of the world. And so we'll have speakers from 3 continents, which is not bad, I think, and from, of course, 2 different specialty, urologists and gynecologists. And yeah, we really aim to, I would say the program is very ambitious. We really aim to cover it all, from setting up the program, I would say, picking up the right indications, the right cases. How do you want to be trained, educated, developing standardized training program, and then, I mean, technically a little bit also how you want to enter the robot. And I think it's also the right time to do it, because we're seeing more and more robotic platforms coming in, and all these different robotic platforms can have different assets for us. So which robot do you want to pick when you want to start is one of the questions we may want to answer. Again, I think, yeah, it's going to be very exciting. And from a personal standpoint, I've been very lucky to have space with the robot for over 10 years now. And even in my own practice, I've seen robotic grow and grow and grow. And we're very far from knowing, I would say, the potential of the robot. And so we'll try to figure that out all together. But I think it will continue to expand, and we'll also try to have a perspective in what the future holds for robotics in our field.
I think that's a really great point that all of you have made. I think that robotics is really a great tool for anybody who operates in the pelvis. And I think that's what people are realizing is, open surgery is fantastic for certain procedures, but really being able to dissect into the bladder, the vagina, by the prostate, near the ureters, getting that visualization from a different perspective, I think is why robotics has really just taken off in the field of urology and gynecology, as you clearly all agree. Is because you're putting on this workshop. And so, from experts like you who've been through these trials and tribulations and maybe sort of made mistakes along the way, it can be very helpful to hear from your perspective about the things that really worked and maybe the things that really didn't. And even just a little bit of the things that really didn't oftentimes can be even more helpful, because you've been through it and you sort of know what you should avoid doing. The other point I wanted to make is that clearly robotics is here to stay, which I think is why the education committee thought this was a very valuable workshop. And one of the ways that we see that is how many different platforms, just like Benoit was saying, have come out with new robotics types of configurations, different ways of doing things, different industry partners that are bringing out different robotic platforms. And so sometimes it can be a little bit uncertain about if you're just starting robotics, like where do you start? And so having the experts like you to sort of guide and give some background is super helpful. So with that in mind, I'm just curious, like the ICS has lots of different members from all over the country and all over the globe. And there are surgeons, there are physical therapists, there are nurses, there are urologists, colorectal surgeons, gynecologists. And so who do you think would most benefit from this workshop in your perspective?
Yes, obviously the workshop in first intent is aimed at surgeons, both urologists and urogynecologists from all over the world. And I think it's valuable for both early career professionals who are, still developing into reconstructive surgeons or aim to do that. And in that regard, the robot will be here to stay. And it's essential that robotic skills and proficiencies are part of the toolkit. Not everybody will benefit from a robotic operation, but you should have it in your toolkit so you can apply it in the right situations. And on the other hand, there is like all of us in the speakers corner who were or still are well experienced open surgeons, but who developed into robotic surgeons as well. And I think for those colleagues in similar situations, it's very interesting as well. And that applies to both urologists and urogynecologists. And as I said, from all over the world, because I have not yet introduced two other speakers who could not be here today. One is Jacqueline Zilius. She's a urologist in the US who has developed a robotic program. And then there is Giuseppe Campagna from Rome. He's a urogynecologist. And he has a lot of experience and published in with a newer robotic system. So that adds another perspective and both new perspectives. So yes, that's the audience and the complete lineup.
I totally agree. I think that this is a great course for our ICS members who are listening, who are in early career. This is a pivotal course for maybe you to take right now as you start your practice, to hear from the experts who've been doing this, and implementing robotics into their practice, but also for potentially those ICS members who've been doing open, maybe doing some laparoscopy, maybe finding that they're now getting a robot at their hospital, or maybe their hospital's asking them to make a case for, buying a robot or renting out a robot. And this is a great course for them to come and hear from you guys, so they can start to think about what their practice is going to look like implementing robotics into it. I mean, we all agree, I think, everybody on C that is putting on this workshop, as well as myself who does robotics, that it is an excellent tool to have in your toolkit, just like Michel was saying, and to be able to know how to efficiently set that up, maybe in a place that doesn't have a robot, or if you do have a robot, to how to use it into your practice, is just an invaluable, thing to know as you start, as you start to build it up in your hospital or in your institution. So I just want to thank you guys so much for joining me today to kind of talk about your workshop. I know that it's going to be, after this podcast, you're going to get lots and lots of people are going to rush in to register. So I suggest for all of you listening that you sign up for ICS 2024 register and sign up for this workshop. Before we go here, any parting words or anything else you'd want to add about the workshop that you guys are going to be putting on in October?
Yes, as said, I hope there will be a lot of attendees, not just to fill the room, but I think the speaker lineup and the different contents and the different perspectives will not only learn you something, but hopefully allow interaction. And I think one of the biggest goals or benefits you can reap from it is that you will be in touch with mentors and proctors from around the globe. And hopefully you can liaise with them and it doesn't end at the end of the workshop. Hopefully the interaction can go on throughout ICS and that will help you.
Well, everybody, you've heard Dr. Michel Wyndaele has offered to be your robotics instructor throughout your career. But I do agree with you. I think having you guys are the experts in this field. You are the experts in this tool, and to be able to have a relationship, form that relationship, so that you can sort of guide other ICS members who are starting on this path is really a valuable thing. And we just thank you so much for putting on this very necessary workshop, I think, at this time. So with that being said, if everybody wants to, just as a reminder, it's workshop 8, setting setting up a robotic urinary tract and pelvic floor reconstructive surgery service. It is on Wednesday, October 23rd from 2 to 3:30 p.m. If you go into the website at ICS, you can register and there'll be an option to sign up for the workshop. So you can do that right now. And we will all see you in Madrid in October at ICS 2024. So thank you again for joining us, and we will see you soon.